Hello, and welcome to Summer Travel Tips for Safe Trips. My name is Annie Long, and I'm a program manager for the Parkinson's Foundation. The Parkinson's Foundation will be hosting virtual events each Monday, Wednesday, and Friday. To learn more and to register, please visit parkinson.org/pdhealth. You can also visit this page to view archived PD Health at Home programs. Before introducing our speakers today, we'd love to know a little bit more about our audience. If you have any technical challenges with the poll or at any time, please use the Q&A icon and we'll respond to you right away. So first, you'll see a question pop up on your screen. Please take a moment to answer it. How long have you been living with Parkinson's or caring for someone with Parkinson's? Okay, it looks like the poll results have come in. Thanks to so many of you who responded. It looks like the majority, about 60% of us today, have either had Parkinson's or have been caring for someone with Parkinson's for less than probably 5 years or less. So thank you so much for sharing that. All right, we have a lot to get to today. So I want to start by introducing our fabulous speakers for today's presentation. It's my pleasure to introduce Jessica Shurer and Dave Malarkey. Jessica Shurer is a master's level clinical social worker and the center coordinator of the Parkinson's Foundation Center of Excellence at the UNC School of Medicine. At the Movement Disorders Center, Jessica assesses patient and family challenges and provides resources, referrals, and counseling as needed. She also coordinates the specialty Interdisciplinary Parkinson's Clinic, facilitates local support groups for Parkinson's and atypical Parkinsonism, and organizes educational and outreach programs for both Parkinson's families and healthcare professionals. Joining Jessica is Dave Malarkey, who was diagnosed with Parkinson's more than 15 years ago at the age of 46. In 2017, Dave joined the People with Parkinson's Advisory Council, bringing not only his experience with the disease, but also his background in veterinary pathology. Dave encourages people to stay active and still enjoys traveling. He's here today to share some useful travel tips that he's picked up through his own experiences. So Jessica and Dave, take it away.
Thanks, Annie. And thanks to the Parkinson's Foundation for putting this on and asking us to be here today. It's a pleasure to be with everyone out there in the void who we can't see. I just want to say first and foremost, I'm just going to be real. I'm actually on vacation at the beach right now, and my family is in the other room. So I do apologize in advance if you hear them at any point, and I can't guarantee that my 2.5-year-old won't knock on the door. So just letting everyone know about that. But we do have a lot to cover today. It's probably, this topic is way more than we're able to cover in an hour. And like they said, we will save time at the end for your questions. We're talking about this today because we recognize that traveling during the coronavirus pandemic can look a little different, just a little bit, than it used to. And many people are choosing not to travel right now. It's a very personal decision, but for those who are thinking of traveling, we wanted to take this time to talk about how to do that as safely as possible, both generally in terms of traveling with Parkinson's, but also considerations around COVID. But before we continue, Dave wanted to share a little bit about why the passion and the experience that he's bringing here today to kind of get us thinking about traveling.
Thank you, Jessica. But first, let me give a shout out to my moving day team. Our team has been together for 8 years now. It's been a great group of people. I really appreciate your work and efforts at the moving day. And I also want to thank my fellow Rocksteady Boxer members and PD support group in the Triangle area. We got a lot of connections there. So I've been working full-time and raising a family of 3 children with my wife, Kathy. So I came at a time when I was very active in my work life and home life. And I go by the quote by Michael J. Fox, is that PD does not have to stop you from achieving good things in your life. So I live by this, and I go live life to the fullest. And I want to show you some examples where I live life to the fullest. Here we are on one of our first family trips. This was in New York City. And it was the beginning of my 15 years of adventures with the family. We have been around the nation and in the globe, and I decided early on that I was going to miss out. I wasn't going to miss out on these activities, no matter how unmotivated I might feel or tired or achy. I was still going to go on these trips. I was going to participate. You know, they say be there and be present with your family and your friends. That's what I wanted to be. So I was there. I wasn't in this picture though. I was taking it. In the next slide. These are my grown children now. So this is at Bryce Canyon just a few years ago. And we did a lot of hiking around there. And I would hike with most of the times. And some of them were strenuous, and I would stay back and do other things, like watch for birds and things like that. Next slide. Here we are skiing in Wintergreen in West Virginia. I think that's in West Virginia. But we had a great time there. And there I am on the right. I actually did ski and make it to the bottom. I fell a few times, but I still had a good time skiing. And it didn't stop anybody else from snowboarding and skiing my kids were doing. Next slide. This is a slide of a trail horseback riding in Yellowstone National Park. They got me up on that horse and took me down. I couldn't do it by myself, but once I was on the horse, I stayed on it for the whole trail ride. That was a great time. Next slide. This is a whitewater rafting in Snake River in Wyoming. And those are the Grand Tetons in the background. So we've been fortunate to have some nice trips. And this one, next slide. I didn't want to necessarily go on the White Rapids, but I decided to go. And I look like I'm the most secure one on there. My wife and daughter towards the back are really having a scream of a job there. They're really excited. I'm just trying to keep my balance and stay in the boat. Next slide. My neurologist warned me, don't just put yourself into dangerous situations. The mule ride down the Grand Canyon was one of those crazy activities that I didn't want to take part in. So I stayed off and looked for birds. I did manage to complete a 10-mile hike along the northern rim of the Grand Canyon. And that was me in the last picture, if we can go back. It was me. There I am on the right, finishing the 10 miles of hiking, and my son called me a badass for this achievement. Okay, the next slide. This is one of the birds I captured in photography when I was doing bird watching instead of going on a hiking trail with the family. So you can find things to do. That's it for my little experiences. Next. Here we are.
Dave, thank you so much for sharing those with us. I love all those pictures. I always love the pictures that you take of birds too. You're so talented, but I think it's a perfect way to get this conversation started today, because I love that approach that you take of it. Traveling with Parkinson's can look a little bit different. And I have had a lot of people over the years share with me that it can be intimidating to do that. Might not be as spontaneous as they would have liked to travel, but you're still able to have a good time and enjoy yourself and have those adventures. And you truly are a badass for those things that you've done. So I think that's a perfect way to start out today. So I'm really, and at the very least, even if people aren't traveling this year, I think that that gets people excited to think about what trips they can take when all of this is over, whatever that means or will look like for us. So do you have anything you want to add about that, Dave, before we jump into our next poll?
Yeah, that was good.
So we had another poll. Since we can't see you all, we just want to see sort of where you're at with things. So we wanted to ask you if you're planning to travel anywhere this summer. Yes, no, or maybe. And I promise this is anonymous, so none of us can judge anybody else about whether or not you're going to travel. So we'll just leave that up for a couple seconds. Okay, so it looks like a slight majority is not planning on traveling this year, but it's actually kind of pretty similar across the board of a mix of yes, we're going to travel, no, we're not going to travel, and we might travel, maybe. We'll see where we're at. Okay, thank you. So, you know, I don't think we can talk about travel right now without the lovely elephant in the room of coronavirus. And so we had one more question for you before we jump into considerations around coronavirus. So we have another question, another poll, which, once it comes up, it is, if you were going to travel, or maybe even if you're not, who would you talk to about travel risks before making plans this summer? So you can tell us if you would talk to your family, your neurologist, neighbors, call the Parkinson's Foundation helpline, maybe your family doctor, or somebody else, someone who we didn't list here. Family is the big one, and I think that makes a lot of sense, especially because they're the ones closest in your comfort zone and probably who would be traveling with you. But it looks like neurologist is a pretty close second, which also makes a lot of sense. And this is some of the things we're going to talk about with general travel is, considerations specifically around your Parkinson's disease with traveling. So thank you all so much for taking that. So we'll kind of just dive into it, starting with COVID. So when we've had people approach us over the last few months asking about risks associated with COVID and Parkinson's, we have some tips that we've been sharing with people. And we've also had some patients and families and support group members sharing their tips with us. So one thing to consider is researching COVID trends in the area you're wanting to travel. As you all know, it kind of looks a little bit different in different parts of the country, going up in some places, going down in some places, kind of plateauing in some places. So I think that's really important thing to be aware of before you decide where you want to go, or to be mindful of if you're going to a place that's, say, having an upward trend of that right now compared to where you live, then you can still go there, but you might just have to put a little bit more safety protocols in place. And then along those lines too, something that we're considering is, are there specific local guidelines around COVID, and are they different from where you might live? So for example, I live in Durham, North Carolina, and we've had different phasing and sort of things have been opening at different rates than, I told you all I'm on vacation at the beach, than where I am right now. They opened a little bit faster and they had a little bit different guidelines here compared to where I live. And that's just something that I needed to be aware of. Something that's also been happening recently around this is being aware of new policies that might be coming out. And you all know how things are kind of just changing still rapidly. Policies regarding quarantine in certain areas. So for example, New York is, I don't know the specifics on it and I apologize, but New York has some policies around quarantining yourself for 2 weeks after arriving in New York from a handful of states, North Carolina being one of them. And so that might just be, that's quite an important thing to be aware of if you're going to go to an area coming from an area and they're saying that you need to quarantine for 2 weeks. And then, of course, I think a big consideration is what can you still do safely while having fun at your destination? So, you know, safer things tend to be outside where you're not in circulated air and closed space and touching surfaces, and a little bit farther away from people. So for example, the beach or outside attractions, taking walks. Pools, I've seen some pools that are staying open, some pools that have closed, some pools that are open, but you have to sign a waiver. So that might be something to be aware of too. And then also food, of course. And I have to mention food because food is my favorite thing. So wherever you're going, if you're going to be at a hotel versus a family's house versus a rental property, you know, how are you going to get your food in that area that might be a little bit different from what you're used to where you live? So knowing what the takeout looks like, are there certain restaurants that are doing curbside pickup or delivery? Are you gonna just cook at your house and not go out or take out anywhere? That depending on where you travel, those things, like I'm noticing here at the beach, you know, we don't have as many curbside pickup options as we do where I live normally. So we're just kind of working around that. I know I'm kind of throwing a lot at you. There's a lot of considerations. Before I continue, Dave, do you have any thoughts to add on what I've shared so far?
Yeah, we're going to the beach next week.
Right.
So I'm curious to see how things are going to work out as far as the food. We're going to bring all the food that we're going to eat. We're going to bring as much of it as we can with us so that we're stay confined at the house that we're going to be in.
Yeah. So that's a big planning thing for you. When you're going next week, what other kind of considerations or plans have you made for that regarding COVID?
Pretty much we're going to stay in the house most of the time. We're not going to go out in social places. So we'll be confined. But it'll be nice because it'll be by the water. So
exactly. Well, I think that's a really good point, Dave, that I've had a few people say to me that they haven't really seen I was just recently having a conversation with someone where they said that they're not really seeing the benefit in traveling anywhere if they're just going to stay put the whole time. But then we ended up talking about how it's just a change of scenery. Like if we've all been kind of huddled in our houses for the past 4 months, I'm losing sense of time, but you can still kind of stay in that comfort zone, that bubble, but you'd at least have a different scene to look at and different air to breathe for a little bit. You're going to be by the water, which sounds like that's going to be really refreshing and kind of recharging for you.
Yeah.
And I know something that you and I have talked about, Dave, is what you're going to plan to bring when you're traveling. And so you mentioned you're going to try to bring as much food as possible. But of course, we all have to think about the things that we have in our day-to-day life to help protect us from getting coronavirus. So like masks are one. And what are your thoughts around like how many masks to bring? Like what's your plan for that?
Well, we wear a mask all the time, pretty much. And when we're in public. So we need plenty of masks.
So you're going to bring multiple masks with you?
Yeah. Kathy, my wife, has made some, and we may buy a box of some. But yeah, we're going to stock up on those. So I don't know about stocking up on toilet paper. I've never understood that one, but. Yeah.
I'm still not understanding the toilet paper thing.
Yeah.
But that's a good point too, because maybe the area where you're traveling, depending if you're using a rental property, they may or may not have toilet paper there available. Or if you're going to a different area, we don't really know what the store's supply of toilet paper looks like. So that could be a consideration of something to pack and bring with you.
Mm.
And so we also think about our other things that we typically are recommending right now to help stay safe as possible. But that might not,
Sanitizing wipes.
Yep.
Hand sanitizer.
Yep.
Gloves.
And sanitizing wipes is a good point too, Dave, because if you're going to like a hotel or if you're going to a rental property, I've had a lot of people share with me that the first thing they do when they get there is they just wipe down everything.
Yeah.
So you have to come stock with that. And gloves, some people are using gloves right now, some people are not when they go grocery shopping or go to any kind of place where you're going to need to touch items. And so just remembering to pack that. And then so when I knew I was going to do this talk, I sent an email out to my support group, one of my support groups, to ask if people could share their travel tips with me. And a lot of what I'm sharing today, Echo, is sort of me sharing what they had told me, but also goes along with what Dave had shared. But one of the things that someone told me is with travel considerations right now, that he is not wanting to stop at any kind of public rest stops. And so I know someone who purchased a personal toilet. I had to Google it to see what that looked like, but apparently that's a thing. You could buy like a little portable toilet, or a portable urinal too. I know that some people have done that. And that's something that a lot of us probably didn't need to think about before this, but definitely important if you're going on a long car trip and you're going to need to stop for bathroom breaks, thinking about whether or not you're comfortable going into a public restroom. And if not, how will you need to prepare? And Dave, I know that you also had a really good point around airing out a place when you first get there. Do you want to share that with us?
Yeah. Open the windows initially to air out the place, get fresh air in the place. You're probably not going to be exposed if nobody's lived in the place for a day.
Right.
It's probably fine, but you want to clean it up to move into.
Absolutely. Can't be too safe with that. And it's also nice to have that fresh air kind of move through. Sometimes when you go to a hotel or a rental property, and if it's been sitting for a few days, it can be kind of stale air anyway. But yeah, absolutely air that out. And a really cool resource too that I want, while we're talking about coronavirus, that I wanted to mention to everybody is that the Parkinson's Foundation came out with at the very beginning of this. It's called the PD Hospitalization and Coronavirus Preparedness Fact Sheet, which they just dropped the link for in your chat box, and you can check that out. But it's something that's been a really good tool for us to have clinically. So it could go along with the Aware and Care Kit, which we're going to mention later, or it could be kind of its standalone thing. But it's basically a template that Parkinson's Foundation wrote out for you, that if you were to need to go to the hospital or any kind of clinic while you were, say, vacationing or even at home, and I'm talking about going to the hospital could be a planned thing, like a hip replacement, or an unplanned thing, like a fall or a urinary tract infection or something totally unrelated to Parkinson's. It is a letter that basically says that you could be at higher risk of complications associated with coronavirus, and that people need to take that really seriously. And it also explains that you need to get your medications as prescribed on time while you're in the hospital, which is generally important for Parkinson's, but I think especially important to advocate for right now. And something to be aware of with any hospitalization during this time is every clinic, every hospital kind of has different protocols around visitors or support people. And so sometimes they will let someone come with you to the hospital, and sometimes they will not. And especially when they will not, this type of letter is really helpful to advocate for yourself and explain a little bit more about Parkinson's and what that means for hospitalization and coronavirus. So that's a really cool thing to download, and you could have your doctor sign it, which just makes it gives a little bit more power. But something we hadn't talked about, Dave, but that made me think of that when you're traveling to a different destination during this time, to know where the closest hospital is, or maybe at least the urgent care centers, in case something were to happen when you're not in your normal area. Is that something that you all thought of with traveling to the beach next week?
We don't think about that. We haven't really done that. We've been pretty healthy and safe.
Yeah. I mean,
I don't really look for.
knocking on all the wood in the room around me that you wouldn't need to know where it is, but that kind of just occurred to me is for all of us to be aware of.
It's a good thought. We're generally driving down the highway waiting to get to the sand, the sandy beach. So we look past the
yeah, the sand is what you're headed towards. And that's
yeah.
So at this point, I know there's probably a lot more that we can cover about coronavirus and Parkinson's with traveling, and we will probably throw some of that in with the rest of this, but we also just wanted to talk about some general things about traveling with Parkinson's. But absolutely, if you have questions about what we've just talked about, or if there's anything you want to share, we will have time for that at the end, so make sure to put that in the chat box. So now we're kind of gonna move into just talking generally, and so we wanted to kick that off with another poll for all of you, which is, if you are planning on venturing out during this time, how would you plan to travel? By plane, by car, by train, by boat? I apologize if I'm missing any other forms of travel. Oh, car is the big one there, which makes a lot of sense. And a lot of people are a little bit more hesitant to go on planes these days, and car, when you travel by car, there's a little bit more you can control with that experience. And I'm glad that no one chose boat or train, because to be honest, we didn't really talk about boat or train travel when we were planning this. So we'll spend most of the time probably talking about car, but a couple things that I did want to mention about traveling by plane, because whether that's now or thinking about your past travel or planning for future travel, hopefully once the pandemic is behind us and it's a little bit more comfortable for folks, I've had a lot of tips and recommendations shared with me over the years and then leading up to this about plane travel that I wanted to pass along. So I've had a lot of people tell me to let the airline know in advance if you need a wheelchair, or rather that you need a wheelchair. And I say that because a number of people have shared that they don't normally use a wheelchair, or they might not even use a walker or a cane. But as you all know, in a lot of airports, they have those incredibly long terminals. I mean, it can take quite a long time to walk down it. And if you ask for a wheelchair, a lot of times you can not bypass security, but get through security a lot faster, and they will just take you down to the terminal and even usually let you board the airplane earlier too. And again, just taking advantage of that, even if you don't normally need that type of assistive device. I also had one of my support group members share with me that her husband doesn't always need a cane, but she's noticed that when he uses a cane in an airport, people kind of let him go in front of them and are more apt to open doors for them. They might go through security a little bit faster. Usually you can ask to board the plane earlier too, even if you don't have an assistive device. They don't need to know that you have Parkinson's. You can just, when they call those different people in the beginning, like people with small children or military, you can just step up during the early boarding and say, I have a reason I need to board earlier. I also had a support group member share with me that they carry a little supply of $5 bills with them to give out as tips as appropriate for small acts of kindness while they're traveling, especially by plane, which I thought was a really sweet idea. I have also had people share with me to use a car service to and from the airport so that you don't have to deal with parking. I know that when I travel, and I know I'm only speaking for myself, I don't have Parkinson's, but the parking aspect is one of the most stressful and time-consuming aspects of plane travel, because you give yourself a certain amount of time, and sometimes you cannot, excuse me, find drinking water. Find a parking spot. as quickly as you would like. So just not even having to think about that, take a taxi or an Uber or a Lyft or something. Aisle seats, I've had a lot of people with Parkinson's share with me that when they book a plane that they choose aisle seats because you don't have to squish so much, like kind of side shuffle into seats closer to the window. It's easier to get out earlier and to use the bathroom without having to climb over people. I had someone tell me that they bring an empty water bottle with them to the airport so it can go through security, and then they just fill it up at the other end of security. Or of course you could buy a drink once you go through security, but always to have some kind of drink with you and some kind of snacks to be aware of when you need to take your medication, instead of, oh gosh, I'm supposed to take my medication right now and we've got to go buy water, or we forgot a snack. And I've also had a lot of people tell me over the years that they prefer to try to book direct flights so that they don't have to deal with a layover. But if you're going to have a layover, try to pick one that's a little bit longer. And I know, Dave, you had a story about that as far as a layover goes.
We were flying into Amsterdam for our second leg of the trip, and we were a little bit late getting in, and when we landed, we had 20 minutes to get to the next plane that was taking off. So we were running through the terminal like O.J. Simpson, and we were running, and I accidentally stepped on the sleeve of my jacket, and I flew up in the air, and my computer bag went up, and I was okay. I just did a face plant on the ground, and it was pretty scary. But I got up and it was okay, and the security guy came over to me and said, we want to have you checked out. And I said, no, we have to catch a plane. We're late for a plane. And Kathy, my wife, said, no, he's got to go. He doesn't have time to do this. So they made me ride in a wheelchair, and then that was good enough for them to let me go. So then she's pushing me through the terminal, and I'm tapping people's on their back to tell them move out of the way for me. And we got there right as soon as the door was being closed, and we got in. We got in because they said hurry up. But we were just running through Amsterdam airport, and it's kind of comical when in retrospect.
It's one of those things that's really, really stressful at the time, but looking back, you can laugh at it. Even just thinking of that scene makes me anxious. Yeah. And it also makes me think of the movie Home Alone, you know, when they're all running through the airport in Chicago, O'Hare to get there. And I think Run, Run, Rudolph is playing in the background. Was Run, Run, Rudolph playing in the background for you in Amsterdam? Maybe, probably not. No.
No, they should have played it.
So that's sort of where you learn to maybe choose, if you have to have a layover, to choose one that's a little bit longer, perhaps.
Yeah. But also boarding early is important. I get at the airport earlier than 2 hours, because you got to get stuff in order, and that can take some time. So you don't want to be rushed, and then you get panicked, anxiety kicks in, and you're wondering if you're going to make your plane.
Yep. And I think that's a really good thing to touch on too. Generally with Parkinson's disease, people will share with us that anxiety or stress, those kind of situations can actually make your Parkinson's symptoms worse, and then it becomes this cycle effect. So I can definitely see that playing out if you're feeling really stressed about your travel, and then you feel rushed because you're afraid you're not going to make it in time. And then, what if you start freezing because of that, or tremor gets worse, and then it kind of just slows you down even more. So definitely giving yourself way more time than you actually need. And I think that goes for a lot of situations living with Parkinson's. People share with me that, if you used to take 15 minutes to get ready in the morning and now it takes a lot longer, that's an important consideration with travel. Packing way beforehand, making lists and being really organized, giving yourself more time than you need to get out of the house and go through the airport or whatever you're doing. Any additional thoughts, Dave, around plane travel specifically before we move into car?
The water closet, the restroom. That becomes an issue if you have GI problems and you're going you're going to sit on a plane for 2 hours or 3 hours. And you just want to make sure that before you get on the plane, you use the facilities that you don't have to get up during the flight.
Yep.
So, because that could be catastrophic.
That's huge. Thank you for mentioning that. Yeah. So you kind of make sure, like right before they start boarding is when you could go to the bathroom, if you can avoid going on the plane and, you know, crossing over people and then walking down those tiny halls and squished in that tiny shower-sized bathroom. It's ideal if you don't have to deal with that.
Yeah.
Oh, and you know what, too? We were going to talk about medications later, and we still will. But Dave, do you want to share your thought around how to carry your medications, your Parkinson's meds, when you're traveling by plane?
Of course, you want to carry some with you so that you have some at their destination. Because if you carry it only in your luggage that goes underneath, then you may lose your luggage and then you're stuck without your pills. And then I heard that if you put your pills in a baggie that's not labeled, or you don't have the label for it, they may toss your pills because they don't know what they are. So I've heard that you keep your prescription vials with the pills on yourself. Keep at least 3 or 4 days worth of medications on yourself, and then you wouldn't lose them, because you don't want to be without your medication in your destination.
Absolutely. Yeah, so keeping them in your carry-on rather than putting them in checked luggage. And especially if that makes me think of sometimes I've gone to fly and I have my bag that I don't think I'm going to check because I think it's going to fit in the overhead bin, but then they tell me there's not enough room. And so if that were to happen, to make sure to take your Parkinson's meds and any other meds out of that, if they're going to put it underneath the plane, and put it into your carry-on and carrying it in their original prescription bottles. That's a really good point. So we'll move into car travel, especially because that is, I forgot what it was, like 96% of people or something said that if they're going to travel this year, they're going to plan to do it by car. So we've touched on a little bit with the considerations around if you need a bathroom break at any point, if you're thinking about if you're comfortable or not comfortable using some kind of public restroom, whether that's at a gas station or a restaurant along the way or one of those public rest stops. And if you are going to use a public restroom, then thinking about what you might need to go into that. So having handy, if you want to wear a mask going into a public restroom, whether or not you choose to wear a glove in order to open the doors, whether or not you choose to sit down on the seat, and then of course making sure to wash your hands for at least 20 seconds with warm soapy water anytime you're going to wash your hands during this, but especially if using public restrooms. And stretch breaks, I think that's probably the number one thing that I hear from my Parkinson's community when we talk about travel by car, is making sure to give yourself more than enough time in that car travel to stop a couple of times to get out and just walk around, stretch, because sometimes with Parkinson's, the longer somebody sits, the more and more kind of rigid they can feel, and it can be a little bit harder to loosen up after that. Is that something that you do, Dave, factor in these stretch breaks when you travel by car?
Yeah. My wife tends to like to get there quicker, so she's not as likely to stop. We'll get her to stop most times, and we'll all get out and stretch, especially on the long rides up to the Northeast.
Oh, yeah.
We go up to Connecticut. It's a 10-hour drive. It's hard to sit there for 10 hours.
That's impressive that you take those drives. I cannot I cannot take those drives anymore.
Well, there's a disincentive now that because if you get there now, you have to stay there for 2 weeks.
Right. Yeah, that's the quarantining
Yes.
thing that we were talking about before. Yeah.
That could be problematic. I like my sister, but I don't know if I like her that much.
Hopefully she's not listening to this right now to hear you say that.
She is listening to it. I'm just kidding about it.
It's okay. She'll get you back for that later somehow. The stretch breaks and the bathroom, using a public restroom, made me think about how I have had people personally in my life, but also, you know, patients that I've worked with over the years tell me that when they travel by car, they don't drink as much, that, you know, leading up to that or during car travel in order to try to cut down how much they're stopping to go to the bathroom. And I can completely understand that. Honestly, I kind of do that too, but something just to be aware of, as, you know, we need to be aware of the risks associated with dehydration, especially as we get older, and how that can cause its own issues, especially when you're traveling too. I don't know if that's something that, you know, you and I hadn't talked about that directly, Dave, but do you have any thoughts around limiting your liquids when you're traveling?
We don't really pay attention to that. We drink a lot of water in general.
Good.
So we like to stay hydrated.
It's so important. It's
Yeah.
so important, and not enough people do that.
Yeah.
When I asked my support group for their travel tips in preparation for this, I don't have the picture in front of me to show you all, but I had somebody share with me that they purchased something called a car cane. And you can just literally Google this and it's the first thing that comes up. So car cane. And it's kind of like this little, like a little bar kind of thing with a hook on the end, and it can hook into this part of your car. Getting car transfers can be challenging for some people with Parkinson's disease. And what we don't like to see, but what a lot of people do, is grab onto the car door to try to, you know, pull themselves out, but that is not a stable thing to grab onto. So a car cane gives you actually something stable, as well as a little bit of leverage to kind of hold onto and push down on to get yourself in and out of a car. And they just keep that in their car and they use that normally, but especially during longer travel, I think that would be really important if you're sitting for a long time. So that's kind of a neat little gadget that y'all can look into. Any other, I'm sure there's other things that we're missing here around car travel. Maybe it'll come up in the Q&A, but any other thoughts around car travel, coronavirus related or Parkinson's related, Dave, before we move on?
No, not that I can think of.
Okay. Again, I'm sorry, go ahead.
I think we covered that pretty well.
Okay. And so we'll of course, again, have time for questions at the end. The only other thing that I just thought of is in car travel, some people are not comfortable doing like drive-through restaurants right now, like fast food, or stopping and eating at restaurants. And so thinking about, again, because, you know, coronavirus related, so thinking about if that's something that you're comfortable with, and if you're comfortable with it, but like a lot of people are like wiping down containers and stuff, making sure you have those sanitizing wipes with you, or if you're not comfortable with eating out while you're traveling, making sure you know, make yourself a sandwich beforehand or have plenty of snacks to munch on in the car so that you don't have to stop for food on the way. That just occurred to me. So now I'd love to move us into medications. I know we've touched on this a little bit in this, about keeping medications in your carry-on, having that note from Parkinson's Foundation that explains needing to take your medications on time as prescribed. Dave, you mentioned having extra medications, leaving them in the original bottles. Anything you want to add to that? I know you had some good thoughts around that.
Yeah. What did I say about them?
Something I remember you mentioning to me earlier was about refilling medications before you travel.
Well, I was thinking, yes, I did mention that earlier, but it's a good idea to have your meds available before you go, so you have a good supply while you're on your trip. Even bring extras in case you lose the primary ones you brought.
Yes.
So.
Absolutely. I can't tell you how many people I've had over the years who will call us in a panic from wherever they have traveled to, occasionally internationally, thinking that they had brought the right amount of medication, and it turned out they didn't have enough, and needing us to refill it in that place, which is not impossible, especially if you tend to have your pharmacy like one of the chain pharmacies that you can find in most locations. We can send it there, but just something with your planning so you don't even have to think about it later is making sure you have enough, asking your doctor for a refill beforehand, so that you don't have to deal with that there. Most insurance plans have, I forget exactly what it's called, but it's like a travel override or a vacation override that will allow you to fill a prescription early and provide you with a handful of extra medications. So that might be something to consider too. Like, for example, if you would normally run out of your medications while you're traveling and you normally wouldn't get a refill until a certain time, you can ask them for that override so that you can have it filled before you travel, or, so you don't have to risk running out of it. And then also time changes. I know that most people right now are kind of limited on traveling internationally into international time zones, but we also have a few different time zones within the United States. And so something that has come up a lot for us in the past is how to change your Parkinson's dosing, like medication schedule, not dosing, but medication schedule, in order to accommodate for that time change. So that is something that you can plan for beforehand. If you're going to see your neurologist before you leave, that is something you can go over with them. If you don't have an appointment coming up with them before you leave, you can shoot them some kind of message through whatever portal you all use, or you could call the clinic to explain, I'm going to California and this is my medication schedule. How do I do that while I'm traveling? And then once I'm there, and accommodate for that time change. And then Dave, you could be my Vanna White for a second. Do you have the Aware and Care kit that we can mention to people? Do you have that to hold up for us?
The Aware and Care.
Wait, move it over a little bit towards the camera. Yeah.
There it is. This is something that you can bring with you to keep all your records or information. If you go to the hospital, it has a neck wristband, and it has cards that describe your plan for medications that you need to take, and so that the nurse is there and the doctor's there at the hospital will know that you're on these medications at a certain time. So it's a good way to communicate with them when you may not be communicative. So that's a nice little package. It's free. It's you just notify the Parkinson's Foundation and they'll send you out one of these. People that have them really rave about them.
It's a really, really cool resource, and I'm glad that you have one, Dave. I think they just put the link to it in the chat box that you can all click on, but that's something that you can order for free through Parkinson's Foundation by emailing the helpline, doing it online, or calling the helpline. And so it lets you advocate for yourself the need to take your medications on time as prescribed in the hospital, as well as what your medication schedule is, as well as explaining that there are some medications that are contraindicated in people with Parkinson's, and it has that little list, and just like tear-offs you can give to every single nurse or provider that you see. And I think that's especially important to carry with you now, given that we're in a pandemic, but to have anytime. That way it's like this grab and go thing. we're at the time where I'd love to open up to questions, but I just want to add a couple more things that we wanted to cover before we do that. I know we talked a little bit about using the bathroom. I've had some people share with me that constipation can be an issue with traveling. It can also just be kind of a common non-motor symptom of Parkinson's. And so if that is a challenge for you, bring some Miralax or whatever it is that helps you with your constipation, making sure to hydrate while you're traveling. And then Dave had shared with me some good points about scoping out the bathroom locations, bringing an extra set of clothes, just can't hurt to have. You mentioned using the bathroom before you get into the car, before you go out, or before you get on the plane. And also, I've had a lot of people share with me that they need to kind of scope out the family style restrooms if you're someone who might need someone to come and help you maneuver in the bathroom. Sometimes family style restrooms can be hard to find, but if you're in a place like an airport or, you know, another public location, you could also ask them if there is one. Or I also have a lot of families that are not shy and they just go on into the opposite sex bathroom, and you know, if they need to be with someone, there's not a family style restroom. Any other thoughts around bathroom before we?
I was in Prague last year and we were touring, sightseeing, walking around, and there was one bathroom at the top of this hill in this church, this old church, and I waited till I got up to the top of the hill, and I waited, and I went up to go in, and then there was an attendant there, and she wouldn't take my dollar bill, my US dollar bill. You have to pay attendants to use the bathrooms there. So I went in and had to wait till I got all the way back down to that big hill, and then so I don't know if you next time you go there, if you go there, bring some change with you so that you can use the bathrooms. That was
Probably
fun.
just heard my dog bark in the background. I apologize. But yeah, that's a really good point. A lot of places traveling in Europe, especially, you have to pay to use the bathroom. And
Yeah.
we might not be used to that.
And they don't like the exchange rate on the dollar.
Right.
And she just looked at me and she's like, "You can't go here."
Oh, gosh. The first thing I do whenever I get to a location is scope out the bathroom because I'm afraid to have that kind of thing. So
Yeah.
sounds really stressful. So just a couple more things, and I'm going to try to be quick about this, and I apologize, but I want to mention, and then we'll get to the questions, a couple things to bring that I've had support group members share with me. One is a freestanding rail to go around the toilet. Not sometimes, you know, you might have a grab bar in your bathroom at home, but then that's not available at, say, a rental property or a hotel where you're staying. I had someone tell me that they always bring a nightlight because not all places have nightlights, but it's easier, you know, vision at night can be challenging if you need to get up to go to the restroom. So bringing your own nightlights. I actually, speaking of grab bars, I had someone tell me that they bring one of those sort of suction cup grab bars with them in case they need that in the bathroom or the bedroom where they're staying. I also had someone tell me they bring a door stop with them because a lot of doors aren't automatic or don't stay open, especially if someone's taking a longer time to go through them or someone's in a wheelchair or a walker and they need help and you can't hold the door open. And then I also had someone share with me that they bring a length of satin fabric, which sounds lovely anyway, but they bring that when they travel to put on the bed because it makes for easier transfers in and out of beds. And so I also just want to mention really quick just about planning activities. I know, Dave, you had a lot of really good points around this. Like when you're planning activities during your travel, allow time for naps or at least downtime daily because you can get kind of fatigued sometimes and it's nice to, you know, have that time before you then are spending energy again. Anything you want to add about that?
No.
Okay.
Yeah.
I've also had a lot of people over the years tell me they try to plan activities for on times with their medications. That's on and off times is some motor fluctuations is something we could see as people live with Parkinson's longer. And so plan those activities when someone's on. And then you mentioned in the beginning of this, Dave, a really good point about planning for alternative activities of, you know, if you're not comfortable for whatever reason during doing a certain thing that say your family is doing, then you go and do your own thing that you're more comfortable with, or alternating between, you know, something very energetic and something very relaxing, or one day doing something the family wants and one day doing something that you're more wanting to do. And you also mentioned that your neurologist generally said just to be aware of dangerous situations, like maybe uneven terrain or things that can, you told me, don't walk along a 2-foot ledge in the Grand Canyon. I don't know if anyone should do that, but especially if you have balance challenges, something really important to keep in mind. And I just generally had a lot of people over and over tell me that they have to be extra organized with planning for travel, especially during the coronavirus pandemic, but just generally living with Parkinson's. And I know I said in the beginning of this that sometimes people can get kind of frustrated with not being able to be as spontaneous of travelers as they used to be or would like to be, but that you were saying, Dave, Parkinson's doesn't have to stop you from enjoying travel and having good memories and experiences with your family.
Yeah.
But just being mindful of our time, and I do apologize that I just kind of plowed through that, but with just a few minutes left, I'd love to see if anyone had any questions that we'd be able to answer in that time.
Yeah, and Jesse and Dave, first of all, thank you guys so much. This was fantastic. We had several questions come in. I think we'll probably only have time for 1 or 2.
Sorry.
Oh, no. But you guys, I think, have covered so much. So this has been wonderful. And for anybody who whose question we do not get to, please feel free, of course, to call our toll-free helpline, 1-800-4PD-INFO. It's a fantastic resource and it's free, of course. They're just there to answer your questions. So Jessica, one of the first questions I wanted to ask you is, this involves planning, obviously, for your trip. So somebody asked, should we ask the hotel or motel, whether you're stopping along your car trip or whether you're staying in a hotel, should you ask them in advance really how they sanitize their facilities? And should that be a determining factor, in terms of whether you're staying there or not?
That's a really good question. I think it's a very personal decision. It depends on, your sense of safety and what you're comfortable with, but it definitely, you have nothing to lose by asking that kind of question. I think generally when we're all navigating the world in these weird times right now, we need to make informed decisions. And so if you're going to a restaurant or a hotel or a Airbnb or whatever, knowing what, their sense of safety protocols are their staff wearing masks, are they sanitizing things? And then based on what they share, then you'll know if you're comfortable entering into that situation or not.
And then do you think it's a good idea for somebody to let their neurologist know that they're planning on taking a trip?
Dave, do you have any thoughts on that one? Like when you travel, do you let your neurologist know?
I didn't, in general, I don't. I just go on trips, but it was helpful this past time, my past appointment, with talking about how to overcome some obstacles that we might run into, and whether we should be aware of anything.
It might depend on the specific kind of travel plans that you have. Like I remember before the pandemic, you were planning to go to Europe and you had asked about the medication refills and how to change your medication schedule in order to accommodate for the time zone changes and other things to be aware of. But if someone is just, say, going to the beach for the weekend or going to go visit their family in the mountains or whatever, you might not feel the same, like that you need to ask your neurologist or let your neurologist know. So it might just be kind of case dependent, I would imagine.
All right, and we probably just have time for one more quick question. So Dave, and Jessica and Dave, again, you guys have been amazing. But Dave, somebody wanted to know, other than the activities I think that you've already talked about, what are some of your favorite activities from past trips that you feel most people can do safely, without worrying about falling down?
Well, it depends on what stage you're at. And I've been pretty active. I do a lot of exercise, and I've done that constantly for the past 15 years. I've been into exercise. That keeps me in good shape. And there was really nothing that I couldn't do. I've gone to Hawaii and swim with the turtles and gone to lots of places. And my favorite place was Hawaii, though. That was a wonderful place. And then my wife, Kathy, gets me involved in. I mean, she's the one that gets me moving and she plans the family trips. So she does a lot of work to get us some good trips and really fun times.
Well, and Dave, it reminded me, Kathy wanted us to let everyone know just how adventurous you are. And she really thought it was important that we communicate that you've been up for anything. You know, certainly while you've dealt with maybe limitations and certain challenges, that you're always willing to jump in and say yes and do what you can, and that you've lived a really full life of traveling and fun and vacation. And so I think you are a great example for everybody listening today. So again, Jessica and Dave, thank you so much for joining us. Thanks to all of you who were able to join us today. We hope to see you next week for our Wellness Wednesday at 1 o'clock Eastern Time. It's on falls, risk, prevention, and recovery. We'll learn about strategies for reducing your risk of and preventing fall-related injuries and how to recover if you do fall. For a complete lineup of our PD Health at Home virtual programs and for a recording of today's session, you can of course visit parkinson.org/pdhealth. And for up-to-date Parkinson's information and support, please visit our website at parkinson.org and call our toll-free helpline at 1-800-4PD-INFO. So thank you again for joining us. Thanks again, Jessica and Dave. You guys were amazing, and stay healthy and safe, everybody. Thank you.
Thank you, everybody, so much. Thank you, Dave and PF. You're all awesome.
Yeah, thank you.
Everyone have a good summer and stay safe.
All right.